My name is Jo Sinclair and I'm a fertility coach and the CEO of a not-for-profit organisation called Fertility First UK. Our core objective is to support all individuals undergoing fertility issues through a free service. Our session today is entitled Fertility MOTs, How Knowledge Today Can Help You Succeed Tomorrow. And I'm pleased to say that I'm joined on the platform by some great panellists full of experience and expertise. Many people only discover fertility issues when it's too late for effective intervention. This panel today will explore why early awareness and regular fertility MOTs are key to understanding your reproductive health well before starting a family. Panellists will discuss how lifestyle, age and medical factors impact fertility and how knowledge and proactive checks can empower better choices for the future. Can I also encourage you all, as we go through the session, if you do think of questions or things you want to ask, please can you get involved and get engaged, because this session is for you. We want to answer your questions, and we have a session at the end where we hopefully will get through as many of those as we possibly can. Because by opening up the conversation, we aim to break down stigma, encourage early action, and give individuals the confidence to take control of their fertile health for today, so they can have more options tomorrow. Let me introduce you to the panellists. We have Dr. Ajit Gill, a senior consultant in assistive reproduction and infertility. Sean Greenaway, who is a male fertility advocate and co-founder of Nexus Fertility. Yemi Abdibile, a fertility senior nurse consultant and co-author of Infertility Doesn't Care About Your Ethnicity. And I'm also joined by Jag Sinclair, Chairman of Fertility First UK, who will be talking about fertility statistics and co-hosting with me today. Before we start the session, I'd like Jag to present some simple facts about fertility issues.
Thank you, Jo. I think we're going to get a table on the screen. Hopefully it's big enough for people to see, but I just want to give you a few seconds to absorb some of this information. Some of it you may know, some of you may not. But 1 in 6 couples, that means 3.5 million people. Studies show that on average, when having fertility issues, it takes 3 full IVF cycles to be successful. A single cycle in a private fertility clinic could cost between £10,000 to £15,000. Fertility treatment on the NHS is a postcode lottery, where some authorities only allow 1 attempt, and that only after some very strict requirements are met and time delays. The information on this sheet is very important, I think, to absorb. And we are going to share with you today knowledge, not only about fertility MOTs, but also about infertility in general, whether it's for both men or for women. Thank you, Jo. Let me hand back to Jo to start the session.
Thank you, Jag. I'm going to move on to speak to Ajit Gill, who's a senior fertility consultant with loads of experience behind her. Firstly, I want to ask you, Ajit, when people often say about starting a family, they say there's this time clock running in the background. What does that mean from a medical point of view?
Yeah, you have asked me a very important question. Biological clock is very important, especially where women is concerned. To start off, the most fertile period for women is between the age of 21 to 32. Then it starts downhill. And after the 35, there is a big downhill. But after the age of 40, it's massive downhill. So that's the reason the Royal College advises people, if possible, to achieve conception before the age of 35. Even with the male, the age does play an important factor, because the quality of the sperm gets affected as the age advances because of the increased incidence of DNA fragmentation. So that's the reason, like in donor sperm banks, they advise men, the age limit is 45, but a lot of the sperm banks, they pick up the donors who are in the age of 30s.
What are the most common causes of female and male infertility?
For the women, most very common cause is the hormonal imbalance leading to ovulation issues, like women with polycystic ovaries, and also age-related downhill of the egg quality, which happens with older women. And then there are conditions which blocks the fallopian tubes, like endometriosis or infection with chlamydia in child when they are teenager. And then it's the uterine factors like fibroid uterus, very common among African women. Then the very important thing which I like to bring is the lifestyle. I'm amazed to see so many young women who are coming who have been smoker in the teenager. When they come for the fertility checkup, their real egg count is low. And even obesity, that can affect ovulation. For men is mostly whether it is a problem with the testicles, which can be due to hormonal imbalance, or they had undescended testicles, or if they had mumps when they were teenager, which led to damage to the testicular tissue. And also cases like infections like HIV or gonorrhea, which blocks the tubes. And again, also with the lifestyle, if the men, they are excessive alcohol consumption, smokers, obesity, and also using anabolic steroids for different issues, that can also affect the fertility.
In relation to women, from your experience, what are the percentage chances of success using one's own eggs as our biological clock is running down?
Yeah, that's very, very important questions, especially if woman is undergoing an IVF treatment. I'll give you the statistics. If a woman is less than 35 years of age, success rate is 45 to 50% per embryo transfer. What is embryo? Which is a fertilized egg. If at the age of 38, it drops to 30 to 35%. At 40 is only 15 to 20%, and at 42, 5 to 10%. And after the age of 43, it's less than 5%. So it's an amazing drop as the woman's age advances because it affects the number and the quality of eggs.
I've heard about MOTs for cars, but what's a fertility MOT and in men and women?
Basically, fertility MOT is the assessment of one's fertility, whether it's a male or a female. Now, for women, it's a very simple test. We do the basic pelvic ultrasound scan, which is very important. It tells us about the shape of the uterus. Is there any polyp? Are there any fibroids or any abnormalities in the shape? Then it also tells us about the ovaries. Is there any cyst, like endometriotic cyst? But the most important one, which we call as antral follicle count, that will give us the actual ovarian reserve, means the capacity to produce the eggs at that age, which is then confirmed by the blood test called AMH, which is produced by these antral follicles. So the combination of AMH and antral follicle count will tell us about that age group. Is her fertility normal, below normal, or sometimes even excessive follicular development in like polycystic ovaries? For men, we do the simple semen test. We check the count, then the motility, and the percentage of living sperms and abnormal sperm. So, which then we compare with the WHO guidelines of the semen assessment. So, these three factors, AMH, scan, and semen assessment.
So, what are the benefits to having this type of MOT?
Yeah, I definitely, most of these MOTs we like to do in women in their late 20s or early 30s because that time period is so important. And they, because you find lots of couple coming there, they're planning to have children later. If we do the MOT, if you pick up some issue, they can proceed, they can plan conception soon, or they can plan, have an assistance, fertility assistance. And especially now these days, I'm seeing a lot of young women, they're coming at, then you have, if, say due to some reason you can't have a child now, but you can have the fertility preservation. The young girls can, they freeze their eggs, heterosexual couple, they can freeze their embryos. But one very important thing I would like to stress at this, most of the time your GP refers you to NHS when you have tried for at least 1 or 2 years. Then you wait for 6 months to 9 months to get an appointment. Then they start investigating you, and every appointment there is a gap of 6 months, 3 months. And by the time they have found out the cause, we have wasted so many years, and they refer them to IVF treatment, which is a waiting list of 1 year, 2 years, depending on the area health authority. But those few years are so important, as I've told you, the success rate of IVF, that if we have picked up these issues earlier, they can be referred. They can be referred to early, or they can be they can have a treatment planned earlier in life.
So what groups of individuals do you see in your clinic? What are the percentages of the groups that do you predominantly work with?
It's amazing how the trend have changed with years. Would you believe it if I tell you I see about 15 to 20% of the women are single women. They're coming for their fertility checkup or egg freezing. And 15% of the couples are same-sex couples. Out of this 45-45% of the heterosexual couples, they you will be surprised to know that 20% of those couples are after the age of 40, and about 60% of the couples are above the age of 37. So I've told you the success rate. So very large number of the patients, they're coming for assistance later in life, where the success rates are much less, and they spend thousands of pounds when having a fertility treatment.
So, Jeet, sorry, I'm just going to butt in here. So, actually, you gave the reasons for, common causes for male infertility, female infertility. So, do you think that having MOTs would help in addressing all these issues much earlier, so that they had time to try and solve these issues before they actually wanted to start a family?
Yeah, exactly. You're absolutely right. At least they know. Once you know what is, if they are perfectly normal, whether they can afford to wait for a year or 6 months. But if there are any issues, they can plan conception early. They can have simple things. If it's just borderline cases, if the lifestyle changes, stop smoking, less alcohol, have a normal BMI. These simple things can be very effective in achieving conception. So MOT does help a lot. They guide
Thank you.
you. They guide you what can they be done before.
Considering your years of experience in the field of assisted reproduction, what would be your words of wisdom to men and women who are looking to start a family in the future?
Yes, the first important part which you started it off, please don't forget there is a biological age, because I'm so surprised. Sometimes I'm meeting these young women, very successful high flyers. They are in late 30s, and they come to me and they say, suddenly we do the test, we find some issues. They tell me that, oh my God, I am so fit, I'm so healthy. But unfortunately, biological window is the age never waits for anybody. Second thing is the lifestyle changes. Lifestyle changes is very important. Cutting down smoking, cutting down alcohol, normal BMI, healthy eating, and taking folic acids and vitamins when you're planning to start conception. These few simple things, age and the lifestyle, is a very important factor.
Ajit, thank you so much for your wise words, and I think there's a lot of information there for people to digest and to think about. Many people believe that fertility issues revolve around the woman in the main, but this actually isn't true. And I'm pleased today to introduce Sean Greenaway, who is a male fertility advocate and co-founder of Nexus Fertility. So, Sean, I'd love to welcome you in and find out a little bit more about your own personal experiences and how that has taken you forward. Could you share with us when you found out about having a fertility issue?
Absolutely. Good afternoon, everyone. Thanks for having me. Like Ajit mentioned, one of the common causes of male factor infertility is mumps, which I had when I was 22. So, kind of the crucial factor there being post puberty. and the damage that did to my testicles, then some years down the line, when my wife and I started trying to conceive, became a lot more prevalent than it was spelled out to me at the time. And the months rolled on. And when we went to the doctors and we were both referred for tests, it was established very early on that I actually had no sperm at all.
What had been your perception of males having fertility issues before you found out that it affected you?
I think the perception amongst most of society is that men don't typically struggle with their fertility, that sperm health doesn't decline, all of which, of course, I now know from personal experience, but thankfully it is being discussed more openly now that is simply not the case. Men's sperm health does decline over time.
And how did you feel when you realised that you wouldn't be able to have a genetically related child? Because that is, I think, a very difficult thing for a lot of people to take on board.
Yeah, it's completely like earth-shattering. My life as I knew it at the time, I'd pretty much coasted through life without any major issues or concerns, and suddenly my life got flipped on its head. It's a life-changing diagnosis. Azoospermia that I was diagnosed with is a life-changing word, one that I'd never heard before that moment where I was delivered the news over the telephone, unfortunately. But it's a word that has come to define my life since. How I choose to define it now is different from that initial diagnosis, but that initial diagnosis was shocking. It literally, I went into shock. And then the subsequent years that followed were years full of trauma and grief, and a lot of the times I didn't know I was going through that grief. I was being dragged through it almost unwittingly, unwillingly at times. Certainly some of the more acute phases like anger, I remember that one. And because as men, often we don't have the tools to deal with things emotionally. We're not given that as youngsters. We're told to man up or like don't cry. That's not like you cry like a girl and all this. And so but one emotion that we do get kind of fed as being one for men is anger. So that was often the only way in which this pressure cooker was managing to release. And it's my identity as a man essentially was eroded away. I didn't know who I was anymore, and I had to rebuild that from the inside out. Really, it was a very challenging time. And when I say time, this period went over years, and the communication had broken down between my wife and I at times, even though that we were both very much in this together. And I went very much within myself. I didn't know where to. There was nowhere to talk about this. But I didn't know where to go. But when I started looking, when I started trying to find other men talking about this, there was no one. So it just compounded that feeling that I was the only man that this had ever happened to. I wasn't given relevant signposting by any of the medical professionals. So yeah, very lonely time.
Sean, can I ask, where did you find support in the end, or did you not find support at that time?
No, there wasn't any.
No support.
Part of the problem is that what I was signposted to from our clinic, it just wasn't relevant. I didn't see myself there. There were no male support groups. There were no male counsellors. There was no male specific spaces to go to. So it just all compounds that feeling of isolation, of not being seen. And so I mentioned going inside and having to make these changes from within. That's what slowed things down, because suddenly when you're up here in your head, it's really hard to make sense of things. But I did. I'm pleased to say I did. It wasn't easy, and I managed to find strength from a lot of other stories of other men who have been through life-changing situations, scenarios, none of which were fertility, but I managed to apply their learnings and how they reached acceptance in life-changing situations and start to really apply that to my scenario. And there are a lot of common themes through like life-changing situations, and I thankfully managed to use those as finger holds really to claw my way out of the hole that I was in.
What you say is so emotional and moving. I'm really quite moved by everything that you're saying. But what would you say to men now who might be feeling like this? Because there may be people tuning in today or in the future that might be able to relate to this.
The message for me is quite a simple one, and that's that you're not alone. It doesn't make it as I said, that work, you're still going through this as an individual, but you're not the only man that has ever been through this or ever will go through it. The World Health Organization puts it firmly as half of the problem is originating from men. But like I said, society doesn't tell us that. And just by having community, knowing you're not alone, and having places to go, which is what I so desperately try and put out there for other men now, that solves a huge part of the problem. When you eroding that stigma and that isolation, then suddenly you're hearing other guys talk about stuff that you haven't really been able to label previously. You have all this emotion swirling around, this confusion, this hurt, this pain, but sometimes can't make sense of it. But when someone else might say something, they just might give you that little light bulb moment that can go, oh, do you know what? That's what I'm feeling. That's what I experience. To know that you're not alone, and then just to be able to work together to find a way through, that helps enormously.
Did you talk things through
Joe,
with
can I ask you?
anyone? Yeah. Sorry, go on, Jack.
Sorry, I was going to say, but I'm very interested in the support side, but I know that actually, you co-founded an organization called Nexus Fertility. Could you just explain a little bit more? Because you talk about there was lack of support, and it drove you to create something to give support. So could you explain a little bit more about that from a male infertility point of view?
Yeah, is that is essentially so I started sharing my own story at first, just to try and get the message out there to guys that they're not alone. I always had this itching feeling there was more to be done. It's like, that's great, but what else? So then I met another guy who'd been through it, and we started a podcast. And again, it's that, but what next? Because it still feels like there's so much to do for men. So then it's all about providing this community. Okay, we're putting the word out there, which is like a one-way thing, but actually, how do we get guys to have somewhere to come and to actually come, have that conversation the other way, make it two-way, and also, as part of a wider community. So that's what we do, and whether it's through webinars of other men sharing their story, which are always hugely popular. We've done a number of topics so far on, for example, miscarriage and baby loss, because again, it's something that men often get left out of the conversation from. And then just online support groups and in-person meets as well. And people say, well, how do you facilitate them? I say, we just get together in a pub and we talk. And there's no, it's not really that complex, but it's when men feel safe to be able to do so, they will talk. Anyone who ever says that men don't talk is honestly, it's not true. I see it time and time again, every month, every day. Men talk openly, honestly, and when they feel safe to do so.
Fantastic.
Do you think that things like fertility MOTs and fertility education earlier in life is important and might help people to understand and to avoid issues like this?
Yes, yeah, it's quite simple, really. I mentioned I had mumps. That was in 2005. I was 22 years old. Fertility was the last thing on my mind, but I wasn't given any advice by my GPs where I was going, because I was very poorly. It was horrendous fever. There was no advice given about fertility, so I just carried on. 6 years after that, 2011, I found a varicocele in my testicles, which is another very common cause of male fertility issues. Again, went to the doctors, got checked over. They were concerned, as I was, looking for a tumour. I was cleared for that, but then given no signposting around any knock-on effects of what essentially that large cluster of veins above my testicles can do. And it wasn't for another 6 years after that, when I then met my wife and we started trying to conceive, that issues were apparent. So, there's 12 years there of potential interventions that could have been picked up.
How did you come to terms with actually using donor sperm to start your family? And I think everybody wants to know, how did it turn out for you in the end? Because I know you have a family, and I think people would like to know sort of where it went and how it is for you now.
Yeah, I kind of missed that bit out, actually, but I suppose there was no spoilers there. But yeah, our journey was long, and after a couple of unsuccessful operations, the door was shut for me to have a biological child, and I had to again look at my identity of who I was as a man, what was important to me to pass on. You asked earlier, Joe, did I talk to anyone? Well, Some years down the line, I started opening up more to my wife. And one of the points where I was particularly lost, I said, I don't know who I am as a man anymore. And because I couldn't ask, who am I? It was a big question. I didn't know the answer to it. But the answers that she gave me as to the man that she married, all of those traits that she listed were character traits. And those character traits I could pass
Yeah.
on. They were not dependent on genetics. So then I started looking at my own family situation with blended family and not non-genetic grandparent, like in one case, and having a very good bond with my nieces on my wife's side, not genetically related to me. So we made the decision that we wanted to pursue parenthood via the use of donor sperm, which we did. And in 2021, we were blessed with twins, Ray and Evelyn, who will be 5 next month.
Fantastic.
So my life has been very different since, in many magical. And yeah, I talk about the missed opportunities perhaps, and what the benefits of what a fertility MOT can do. Personally, for me, that they're learning points for other people and to raise awareness. I wouldn't change anything of what I went through because it led me exactly where I should be, and that's the father of my 2 children.
Fantastic. Sean, that's great. I think Joe will probably have to wrap it up there. But Sean, thank you so much. I think Joe's going to hand over to me, I think. And now I'd like to also ask some questions of Yemi. Yemi, we've talked about the stats, and the stats show that actually almost twice as many Black and ethnic minority women suffer from infertility issues than white women. I mean, could you elaborate a little bit more on that?
Sorry, Jack, would you ask me the question again? Because Yami's, unfortunately, her speaker is not working.
Yes, please.
So,
okay, but it may well be. No problem. See, look, technical issue. Yeah. No problem.
We've got Ajit stepping in on this one.
Yeah, very good, very good. So, yes, we want to understand that obviously the stats show that Black and ethnic minority women have twice as many fertility issues as white women. And I just wanted to understand specifically why.
Yes. One of the issues that we find with the women coming from Africa, there is a very high incidence of fibroid uterus. The fibroid uterus is which affects the cavity of the uterus where the baby is implanted. And that incidence is almost 3 times as compared to the Caucasians. And also there is a condition called endometriosis, which is also more common with the Africans.
No.
And so these issues, the factors, they can make it, the fertility treatments, especially the treatment cycles, the success rates are lower in these patients. Yeah.
So knowing the information you've just spoken about in terms of the causes, do you think women of ethnic minorities should do more or could do more to increase their chances of starting a family if they did the fertility MOT much earlier?
So exactly what I was talking before. If the same, because as I said, the most important factor for women to achieve conception is the egg factor, which diminishes as the age advances. So if these women also have an early MOT, like I gave you an example, we do an ultrasound scan. We have checked that this woman is found to have fibroids. So these women then, if their fibroid is affecting the cavity of the uterus, they can proceed for the operations earlier and be treated, and the uterine cavity is sorted out. So they can achieve a conception. Or if there is bad endometriosis, bad endometriotic cysts, they can be removed. And we can give a medical treatment or surgical treatment earlier. These all things can be done earlier than the later part of the life. So it makes a difference.
Ajit, thank you. I think we've got Yemi back. Okay, so I think we're still having some technical difficulties with Yemi, but let's carry on. We look at in your sort of experience, when we actually in your clinic, you must see obviously a number of ethnic minority women come in. Can you tell me, one of the questions I had was, do they find it more difficult to address infertility issues because of their culture?
Yes, I can definitely say we do see a very large of Asian community as well. Somehow they feel that getting pregnant is a natural phenomena. Why it's not happening, and they find it very difficult to accept it. And not only to accept it, they also feel difficult to communicate with people, talk about it, because they feel, especially women, they feel, oh my God, they won't be accepted. And one thing I have to say, especially in African and Asians, uh, uh, to have a child is very important. And if there are issues with women are under pressure, and they do not talk, they do not discuss. And to getting a system where they get counseling, or they can
Yeah.
talk about it, discuss about it, it really will make a difference. Yes. Mm.
Do you think that when you've talked about South Asian women coming into your clinic, do you feel they relate more to somebody who you think they can understand their culture?
Yes. What happens is now in a lot of the fertility clinics, like I give you an example, and we have doctors, African, Asians, or we can speak their language. So I do find if these patients they come to those doctors whom they can speak in their own language, relate their own fears, it helps them psychologically also, and they can communicate better, and you can explain things better to them. So it does make a difference. And also these are the women, they definitely get helped by counseling. And I was listening to your previous conversation with Sean when you were saying that's very important with the male normally, he is very right, they don't want to talk about it, they don't want to discuss about it, and they take it very badly. And the some sort of support system, counseling, talking, uh, it really helps them. It helps them mentally also to cope with the condition, and to also later on to how to deal with this patient. Yeah, that's very important part of fertility. Every clinic should have very good facilities for counseling, communication. It not only starts with the counselor, with the doctor, with the nurses. So they have, because fertility is a very emotional subject. Because everybody is supposed to have a child naturally, and when things go wrong, then they don't understand. For them, they need a very good emotional support system.
No, thank you. Gee, that's really helpful. I know we're having some technical difficulties in getting Yemi back online. So I think what I'm going to do is thank you, Ajit. I'm going to move on to talking to Joe. Sorry, did you have a question? Sorry.
Yeah, I was just going to say we've actually got Yemi back. So I just wanted to
Oh,
quickly ask Yemi a few things, if that's okay. So
great.
thank you very much. Welcome, Yemi.
Welcome. Thank you so much for having me. Thanks. Apologies for that
Yeah,
glitch.
Yemi, I know you're known for your support of women of ethnicity, and you run a podcast. Can you explain a little bit more about this and where you think that women could reach for greater support? Because I know you're a huge advocate for the sector.
Thank you so much, Joe. So the Fertility One Stop podcast is a call to action website podcast, and what it does is it's a platform where the ethnic community, just to raise awareness about what's going on in the community, and to point them to as the right direction on where to go to get treatment, have a safe community, knowing fully well that they're not alone in this. The thing about the ethnic communities is that we love to tell stories, and in that narrative is where you can pull people's history. It just gives them a bit of a safe place where they can share their stories as much as they can or as little, so that other people can know that they're not alone in this journey. But more importantly, call to action.
It's been said that trying to understand the cultural pressures and issues being faced by women of ethnicity would help the fertility process for these women. If so, why does it help, and how could we as a community be better assisting them?
Well, the thing is, we live in a diverse community, and the ethnic community is part of that community, and so is the health, fertility health. It's all known that fertility birth rate is on the decline, and as long as they are in this community and they are contributing, so we want to make sure that the birth rate is also in correlation to that. And what we need to do is to raise awareness, and we need to start from the generation. Fertility is something that is doesn't not spoken enough about in the cultural setting. People don't often talk about their genitals quite clearly, and there's always this secrecy about when you're trying for a baby, it's meant to be somewhere in secrecy. So therefore, when people are going through issues, they don't want to come in and speak about it. So we need to take that into communities, into schools, to say it's okay to to get to talk about it. It's also okay to seek fertility help, and to make sure that they're well supported. It was quite nice to hear Sean, even with men in the Caucasian community not having a community, how much more Black men in that community, as well as women, who are known to always keep quiet and also not to raise their voice.
Yeah, I mean, I know you've co-written a book with Sheila Lamb, which is very well known, called Infertility Doesn't Care About Your Ethnicity. I think it's a fabulous resource for people. Would you like to just tell us a little bit more about that? And it might be a good resource for somebody to be able to refer to as well.
Yes, thank you so much. That book was actually coined around a time where there was all sorts going on, people coming into clinics and not being able to, and as I said, telling their stories. So myself and Sheila, well, we kind of had what to say. It'd be nice for some of these patients who were willing to tell their stories. Obviously, their names have been changed to protect confidentiality. And the aim is that when people pick up that book, they'll either be able to identify with what's going on in that book, or they know somebody who's actually going on, passing through that situation, that book can actually help. So it's not a medical book, it's a prose, a narration of what people have gone through. And if it helps that community, to pass it on, and it can be gotten at Amazon. So yes.
Thank you, Yemi, for that.
Fantastic.
Jack, anything you would add?
Yemi, listen,
hand
thank
over
you.
to you.
Yeah,
That was
no.
super.
Thank you so much, Yemi. Thank you so much for that. And I'm sure there'll be questions for you later on in the question and answer session. I'd like to now just move on to Joe. Joe, you are a fertility coach and the CEO of Fertility First UK. I want to talk about two areas, as we want to give you enough time for questions and answers. First area is emotion, the emotional side of having fertility issues. We've heard it from Sean's point of view. I'd like to ask, because you've been on your own fertility journey. So how is the emotional side? What do you feel?
I think initially you think of it as being a very medical journey, but you realise then that you were on this huge emotional roller coaster of uncertainty. It overwhelms you. You become baffled by things you don't understand. You're in situations where you have no control. And that's what's inspired me to set up Fertility First UK. It's to give people that resource to help them to navigate their journey, to be able to get support and to be signposted so that they never feel alone, because your journey can be so isolating and everybody has different emotions, different reactions. When you're in a relationship, as much as you rely on your partner, you might actually react very differently and feel very differently about different aspects of your journey. And I think it's important that every individual has a unique set of support, of resources and mechanisms to help them to move forward with that little bit more resilience and clarity, to be able to get through how tough a fertility journey can be.
And Joe, I mean, you've mentioned Fertility First UK. You were driven to try and give something back. Do you find that actually that people are restricted because of costs and things like that in terms of finances, in terms of approaching getting support?
Absolutely. I mean, the average cost of an IVF cycle is anywhere from about £8,000 up to £15,000. But bearing in mind that it takes on average 3 cycles, you're talking somewhere in the region of potentially £45,000 for the best chance to have a live birth. That's a huge amount of money. I know from my own experience that the treatment I wanted and needed was actually not available in the UK, and I travelled abroad. And that was the only way for me that I made it affordable and accessible. But what we're trying really hard to do in Fertility First UK is to make treatment more accessible and more affordable, and for people to be able to access more free resources and opinions and consultations.
That's fantastic. Joe, listen, that's really fantastic, because I think, as Sean was saying on the male fertility side, as with the female fertility side, there's a need for support, and hopefully free support, for both men undergoing fertility issues. I think now I would like to throw it open to questions and answers. So if there are any questions for us, Joe, I'm going to hand it back to you.
There's questions coming in. The first one's saying, where do we get the MOTs from and what do we ask for? People are saying they assume they're private, and how much do they cost? I think that's probably one to hand over to Ajit.
Yes, I think. Yes. If your GP is very kind enough, sometimes you can do the basic tests like semen analysis and pelvic ultrasound scan. Now they have started doing also AMH, anti-Mullerian hormone. Yes, it can be done, but some GPs, they don't do it. So regarding your right, a lot of the private units now, infertility units, they offer MOT. I think what it includes is the AMH, ultrasound, semen analysis, and a consultation with the consultant. You're looking around easily five to £800.
Can I add a little bit there? Can I also suggest that people do simple things like sexual health testing and things like regular smears? So the stuff that the GPs can provide that you can actually get for free, if you do those when you're young and you have an awareness for your future, they are really good things to keep an eye on, shall we say, because they are important and they can make a huge difference later on. Anybody else? Shall I go to the next question? Thank you, Ajit.
Yes.
Yemi?
I was just one liner. Is there are some also inexpensive online tests that you can also access that gives you equally the same results, and you can have that reviewed by doctors as well.
Somebody's saying, I'm early 30s and would like to start a family within the next couple of years. What steps can I take to help? Apart from drinking less alcohol, shall I start taking folic acid now? Ooh, folic acid. Yes, definitely. Ajit, this probably is one for you.
Yes, I definitely, you're very right that if you're 30 years of age, I hope you're not a smoker, less amount of alcohol, and your BMI is normal. These factors, and then folic acid, normally we advise at least few months, 3-4 months before you're planning. And very important factor is these days, the vitamin D plays a very important part. Absolutely healthy people, their vitamin D levels are low, and that deficiency of vitamin D can affect the implantation of the embryo. So good healthy diet, and as you said, you can do your MOT to check just in case issues. But these simple things, it helps to achieve conception.
Somebody's asking about women in their 40s having babies, and that sometimes it's not possible before their late 30s because they don't have the financial stability to do it, or the family support, or aren't with a suitable partner, or our partners don't feel ready. So they're asking, I think, about freezing eggs and preservation. Is that the
Yes.
only option? And how does it often work out eventually if you do preserve or try and preserve your fertility? Because I think what they're saying is they don't quite feel ready yet, they're not in a position, but what can they do to give them the best chances of preserving their
Yeah,
options?
this is exactly I was getting is fertility preservation is becoming very popular. Unfortunately, NHS only does the freezing of eggs or women with the cancers who are having cancer treatment. Unfortunately, these fertility preservation is mostly done privately. If it's a single woman who doesn't have a partner, then egg freezing. But if it's a heterosexual couple, I will advise them to do embryo freezing. The advantage of embryo freezing in heterosexual couple, at the same time, you will come to know what is the fertilization capacity of the egg, what is the number of embryos you get. Because end of the day, even whether egg freezing, it's not the pregnancy is per embryo transfer. So if a woman has produced, say, 10 eggs, if everything is fine, sperm is good, egg is good, there is she will get three embryos out of it. One third of the eggs normally become embryos, and pregnancy is per embryo transfer. So if it's a heterosexual couple, even if they are living together, your partner does not want to have children now, they can proceed for embryo freezing.
Somebody's asking, is the advice here basically not to bother with fertility treatment after 37? Which I know it's not, but can we sort of explain that it's not just sort of clear cut-off points? And Ajit, again, I think it's a very medical question for you.
Yeah. Yes, definitely not at all. Like I give an example, most of the units, fertility units, they treat women till the age of 44, 45. And of course, women can get pregnant even when they're 37 or even 44, but the percentage of women falling in that category is much lower. So with some sort of assistance, uh, you can achieve a pregnancy. If you're 37, up till 38, I said the IVF success rate is 30%. At 40 is 15%. Of course, we are getting these women pregnant even in their early 40s, but the percentage is low. The last thing I would like to say, uh, at the moment, we are seeing a very large number of women in, like I told you, in 40s, mid 40s also. These are the women who didn't meet the right person, or they have got the second partner, or due to some issues they didn't have. But even if they can't have the child with their own eggs, there is, after the age of 45, there is a program called egg donation, whether it's from your family or from unknown donor. And that, if as long as the woman's uterus is normal, that will give you a 50% of success rate. And I can tell you, I'm in this field for 30 years, and I'm so pleased to say I've got so many women in their 40s who had children with egg donation, and they are so happy. Just like doing a donor sperm, you're getting an egg from an unknown donor, and it gives them a lot of happiness. Of course, now by HFE's regulation, would you believe it, in England, up till the age of 54 is when you can do the embryo transfer. So you can deliver till the age of 55. Of course, you women get pregnant, but it's the changes from their own eggs to egg donation.
Somebody's asking about approaching their GP and getting taken seriously. I hear this a lot. Somebody saying it took 10 years to be diagnosed with polycystic ovary syndrome, for example. I know that it's taken, on average, between 7 and 9 years to be diagnosed with endometriosis. We know how these things can impact our fertility. Has anyone got any advice for women, how we can try and advocate for ourselves to actually get people to listen to us, to be taken more seriously? Because this is something that is so important. And if the diagnosis is taking so long, how can we then move forward in our journey? I see it all the time, and I advocate for women. But I think if we can give people some ideas on how to advocate for themselves.
Yeah, it's that was the beginning of our questions when we started. That's, I was said, the fertility MOT. You're absolutely right. Polycystic ovaries can be easily diagnosed by simple ultrasound scan, which your GP can refer you. And also the fibroids of the uterus. can be found out by the ultrasound scan, and the blood test, AMH, can tell you about your ovarian reserve. So these two simple tests, which I again repeat is important if they can do it in their late 20s or early 30s. And if they have picked up the problem, they can approach the GP to be said, please, I've got this issue, refer me, and then they can be channeled to referred earlier. But and also then they have the choice. Say, I know private health is much more expensive, fertility treatment, but at least they have the choice. They have the choice to do things if they want to do, even privately.
Joe,
I've got some. Yes,
I had a
yes,
question.
Doug?
We've got a question here, which I think is we can give to actually, I think, Sean. It says, what are the top 5 things you suggest that a man should focus on to improve stroke maintain his fertility?
That's the one I just picked out next.
Sorry.
It's a great one. It's excellent, and definitely one for Sean.
Yeah, sure. I mean, I'll answer this as a patient advocate, not as a professional. I'd say seek professional advice, but I see and hear the same things all the time. So first of all, look at your lifestyle. What are you eating and drinking and smoking? If alcohol and smoking is hugely detrimental to sperm health. So first 2 headline things really there is cut them out where possible. Diet, the kind of generic advice is to follow a Mediterranean lifestyle. Diet. But then also what you're doing in your spare time. Hot heat is not good for sperm. So are you going in saunas often, hot baths, hot tubs, all things to be looking to cut down on, if not cut out completely. And also these days we live a very sedentary lifestyle, and sitting at desks for a long period of time with your testicles being encased by our nice big warm thighs, again, not good for them. So try and bring in a bit more activity in your working day if you do sit down a lot. And then exercise. Are you exercising? If not, really, next question really is why not? But for general health, but of course, our sperm health is has a massive downstream effect from our general health. So bring in some exercises, but take advice on what is good for sperm health, but what can be detrimental as well. So I think they're your top level things, and also, like, again, with diet, be conscious of the amount of microplastics that can be about these days. Like, where are you getting your food from? Don't heat your food in like plastic containers. So there's some really good top level things to start looking at from the outset. But like I said, get specific advice from professionals there. But
Right.
these are the same things that come up all the time.
I'd just like
I'm
to
afraid-
add
That's
just
great.
just a couple of things I would like to add. You did it very rightly. These days we are seeing a lot of men. As you know, the male fertility has tremendously increased. From it used to be 20%, now 45 to 50% is coming to that. And a lot of men we are seeing where the sperm count is low, they are being on anabolic steroids because of the exercises, which affects the sperm. And then the other thing which we are finding is hair products. There are a lot of people they're using, and they're using this testosterone hair products. That can also will reduce the sperm count. So these are the two couple of basic things. With your list was perfect. That lifestyle.
Sorry, and if I can just add one liner to bring it home to the ethnic men community, sometimes there are some products that are being chewed culturally that are being sent home. Now, in the bid to help fertility and the sperm product, but sometimes this can be counter interactive with the medication. So they're being sent some herbs. And some of these herbs are sometimes counteractive. So just to be mindful of that in the ethnic community, beware of what's being given, and especially some herbs, beware of what's been chewed.
I did think of another one actually where it's come up quite a few times where people have started to take up cycling to get healthy. And there are some sports like cycling that are not always great for your reproductive health. So think about that one. Sean, another one for you. The question for the men or about the men are really coming in. Somebody's asking, how could they encourage their partner, their husband, to get tested?
Yeah, there are. It's it's not a very nice experience going to a clinic to get tested, to provide a semen sample. But there are some kind of barrier breakers nowadays about the prevalence of at-home sperm testing kits are there. There are a few good companies that do it. But what I'd say is they will never replace clinical grade testing, but they are a good marker for early kind of an insight as to where you're at. So it gives you you can do it from the comfort of your own home, just get an idea, and then just check who you're going to go with, because some of them do have really good wraparound care if the result is a bit adverse. So yeah, just there's some good companies out there. Look into them.
People are asking, where can I go for this? Where can I go for that? Honestly, if we can't cover everybody's individual questions, it doesn't cost you anything to come onto our platform at Fertility First and ask us. We can signpost almost everybody for almost everything. So if we can't get round to actual specific questions for people, do reach out to us, because we usually can help. So in terms of naming specific things or places, please do. We've got a male with poor motility. How can we support them to maybe increase that? Because I know that sperm health can be improved. It's not something that we can't work with. Often it's easier to work with men and where they are now as to where they want to be. Maybe Ajit, maybe you could expand on that a little bit.
See, as I said, the sperm factors, they can be only slightly below the subnormal, which can affect the fertility. In these cases, what Sean already said, the lifestyle is one important factor. Second factor they can they can take some vitamins, mineral, antioxidants. And very important thing, which has recently, motility, especially if the motility and abnormals are high, they say frequent production of the sperm, which is very important. It reduces the abnormal percentage of the sperm, and especially now with IVF treatments, we are telling people when they're going for the IVF treatment, they must produce the sample every 2-3 days. Before, it used to be abstinence for 3 to 5 days. Now more frequent production of it during the treatment. But just if you're trying naturally, the ovulation period is important, middle of the cycle, when the woman is most fertile. And then also lifestyle things, habits, better habits, cutting alcohol, cutting smoking, and taking you can get in the website actually lots of antioxidants, minerals, vitamins.
Fantastic.
They might improve.
Joe,
Yeah.
Ajit, thank you so much. We have, I think, 2 minutes to go. And I think probably we're Joe, can I hand it over to you to do the wrapping up?
Absolutely. Firstly, I wanted to thank everyone who's come along to listen today, because I think it's something we're all really passionate about, and something that's so important to all of you. Do engage with us. It doesn't cost you anything to get involved with our platform, to ask questions, to get information and signposted. Sorry if we haven't managed to get round to everybody's questions today, but I really am glad you all asked. And I wanted to thank Rail Wellbeing Live as well for inviting us today, because it has been a wonderful opportunity for us, and we work really hard. We are a non-for-profit organisation, and we just endeavour to try and make a difference. I hope that we've raised some awareness and conversation today. And I know it's been recorded. Please take it back if you think somebody could benefit from you sharing this with them in your family or your friends. That's the whole point of this, because sharing is caring. Is there anybody that would like to jag?
I'd just like to thank, obviously, you thanked Rail Wellbeing Live 26. I'd like to thank the panelists for spending their time today. And I'd like to thank the audience too for coming up with such great questions. We're sorry we couldn't answer them all, but we'll get there. Just come onto our website. We'll answer them there. Thank you, Joe. And thank you, everybody.
And thank you to the technical team as well, who've been absolutely wonderful in supporting us and yes, getting us through this all. But thank you, as all being so far around the country and bringing us all together.
Thank you.
Great. Thanks a lot.